Imagine a world where more children are struggling with obesity than hunger. A stark reality that's now unfolding before our eyes. For the first time in history, the number of obese children has surpassed the number of underweight children worldwide, according to a shocking UN report. This alarming trend is largely driven by the overwhelming presence of ultra-processed junk food in childhood diets, which is not only harming their health, but also putting them at risk of life-threatening diseases. Catherine Russell, Executive Director of the UN Agency for Children, UNICEF, warns that obesity is a growing concern as ultra-processed food increasingly replaces essential nutrients like fruits, vegetables, and protein in children's diets. But here's where it gets controversial. While 9.2% of children aged 5 to 19 are underweight, a staggering 9.4% are now considered obese. This shift is not limited to wealthy nations. Obesity has become a major problem, even in countries where hunger and malnutrition were previously the primary concerns. The report, Feeding Profit: How Food Environments Are Failing Children, analyzed data from over 190 countries and found that 1 in 5 children are overweight, with a significant proportion of them falling into the obese category. And this is the part most people miss. The rise of childhood obesity is not just a matter of personal choice, but also a result of the aggressive marketing of ultra-processed foods to young people and parents. The numbers are daunting. 42% of overweight children are now obese, up from 30% in 2000. Pacific Island countries, such as Niue and the Cook Islands, have the highest rates of childhood obesity, with 38% and 37% of children aged 5 to 19 being obese, respectively. Even in richer countries like Chile, the US, and the United Arab Emirates, the rates are alarmingly high, with 27%, 21%, and 21% of children being obese. The UK has also seen a significant increase in childhood obesity, with the percentage of overweight children rising from 29% in 2000 to 30% in 2022. But what's driving this trend? The answer lies in the rapid expansion of modern retail outlets, online grocery stores, and food delivery apps in low and middle-income countries, which has made ultra-processed foods more accessible and affordable than ever before. The consequences are severe. Childhood obesity is linked to a higher risk of heart disease, type 2 diabetes, and certain cancers later in life. So, what can be done to address this crisis? UNICEF is calling on governments to take action by implementing labeling, marketing restrictions, taxes, and subsidies to promote healthier food environments. The organization also suggests banning junk foods and their marketing in schools and providing better support for vulnerable families to access nutritious diets. But here's the million-dollar question. Can we really trust the food industry to prioritize children's health over profits? The report highlights the unethical business practices of the ultra-processed food and beverage industry, which often undermine efforts to protect children from unhealthy food environments. As Namathemba Chandawana, Chief Scientific Officer at the Desmond Tutu Health Foundation, notes, "We often only think of malnutrition as underweight or stunting, but obesity has the same long-term consequences. The economic impact of childhood obesity will be staggering, with estimates suggesting that the global cost of overweight and obesity will surpass $4 trillion annually by 2035. So we ask you, what do you think is the most effective way to tackle childhood obesity? And how can we ensure that the food industry prioritizes children's health over profits? Share your thoughts in the comments below.